This exercise is the bridge, and we'll show a series of progressions to go with the bridge. Before starting the bridge exercise, you want to ensure that you're in neutral spine, which means you've got a small space between your spine, your lower back, and the mat. So between the lower back and your mat, you should be able to slide your fingers under there. You want to engage your transverse abdominis by drawing your belly button towards your spine, but not actually moving your spine. This you'll feel some pressure just to the inside of the pelvic bones. You want to engage the pelvic floor. To do this, pretend like you're peeing and stop the flow, so midstream, stopping the flow. And you want to be able to breathe, so ensuring that the diaphragm is being used. You'll have your knees bent, feet on the floor, and knees slightly apart, or feet slightly apart, so about pelvis width apart. From there, you're going to push through your heels as you lift up through your pelvis. So you can do so now. So pushing through your heels, lifting up through your pelvis, trying to get in a straight line between your shoulder, your hip, and your knees. As you lower yourself down slowly, you want to come down just to a hover, so you're slightly above the mat as you come down. So this is how you raise and lower, pushing through your heels and coming back up. Some things to avoid: I'll have you place your hands now just on your pelvis. What you want to avoid is rotating through the lower back or the pelvis. So here you'll see the hip drop, and then on the other side drop. That's what you want to avoid when you're doing bridges. So hands can go back down, and then coming back down to a hover. The progression from having hands beside you on the floor will be to have your elbows close to your trunk. So bending at your elbows, elbows in close, and then coming back up into a bridge. So that's decreasing the base of support that you've got. From there, it'll be arms up to the ceiling. So hands up to the ceiling. When your arms are up to the ceiling, draw your shoulder blades down and back into your back pockets so that you're setting well through the upper body there, and then raising and lowering. Again, pushing through your heels, ensuring that you stay very stable between the pelvis and the lower back. Now, as you come down into a hover this time, the progression from here will be to put more weight through the right leg. So this will still be both legs. You can leave your arms up, and we'll put about 90% of the weight through the left leg, maintaining that stability, and then coming up and down with about 90% of the weight through the right leg. If you find that you get a hamstring cramp, this means that you may be putting too much weight through your leg, and your hamstrings are being recruited to help stabilize. So back off. You might go back to 60-40 split, or it means that you're going up a bit too high, and you might not be able to tolerate going up quite as high. Once you've done 5 to 10 repetitions, you'll then do so on the left leg with that 90%. And then from there, I'm going to have you come back down into a resting position, so hands down beside you. This next exercise is more difficult, so we'll start with the arms beside you, bridging up as you have with equal weight between the two legs. Now bring your feet together, so squirm your feet in so that they're side by side, so in close. Then draw the left knee towards you to a 90-degree position. From there, you're going to lower yourself down to a hover and then power back up just using the right leg. So this is a challenging exercise, really challenges the stability of your lower back and pelvis while engaging the glutes and stretching out the hip flexors. Then the progression of this exercise will be to draw so bend at your elbows, so same arm progression as we've had before. And then from there, it'll be arms up overhead, which is a much more difficult exercise. You'll look to do 5 to 10 repetitions of this exercise, and then you can come back down, reset your legs, so both legs will come down, and then you'll draw up again with the right leg. So right leg will come up, and then you can lift and lower on the left leg. Again, looking to do 10 to 15 repetitions. When you can do this, then you'll look to progress to doing 3 sets.